Good afternoon and welcome to the Faculty Staff Town Hall sponsored by Penn State Today. Today we will be updating you on the university's ongoing efforts to slow the spread of COVID-19 while continuing to provide educational opportunities to all of our students. And we'll discuss how the semester has been going so far and look ahead. We've received many questions for the Town Hall already, and we will do our best to respond to as many of them as possible, both today and after this session. To answer your questions today, we have University President Dr. Eric Barron with us in the studio. Joining by Zoom, Executive Vice President and Provost Nick Jones, Interim Dean of the College of Medicine, Dr. Kevin Black, Vice President for Human Resources and Co-Chair of the Return to Work Task Force, Lorraine Goff, and Director of the COVID-19 Operations Control Center, Kelly Walgast. First, Dr. Barron, do you have any thoughts that you'd like to share with the audience?
Well, first, I want to thank each and every one of our faculty and staff members for their tireless efforts to make return to campus possible. This semester has had a lot of challenges, and I'm incredibly proud of the work you have done to continue our vital missions of teaching, learning, and research. I know some faculty feel we should revert to remote. I understand the concern and the questions around our plans. However, we are not seeing the indicators that might compel a change of our course at this time, but we will do so if needed. And I'd like to take a minute to discuss several of those elements. We, of course, remain concerned over the student testing numbers, and many have asked for a specific number that would cause us to change course. It's important to understand that it is not a single number that will dictate our decisions and our actions. Our ability to continue on-campus activities will be determined by several considerations. Beyond our daily testing results, there are three particularly critical pieces of data that are related. One is local hospitalizations, spread from our students to employees and the community, and our quarantine and isolation capacity. We're regularly in touch with Mount Nittany Medical Center to monitor its capacity. Our quarantine and isolation space remains steady at about 50% capacity as students leave after completing the required time period. And as our dashboard shows, our random employee testing has only indicated one positive employee that's tested so far positive. We're not aware of one incident of a student infecting a faculty member in the classroom, not one. Mask wearing and distancing has been well followed. I really want to thank our students, our faculty and staff who are doing their part. Ultimately, we remain confident in our plans, which are multi-layered and designed to anticipate the need for mitigation measures. We'll be talking more about those measures later in this town hall. Before I begin, I want to take this opportunity to once more recognize our employees who have been working in new ways. Thank you for what you've done and continue to do for Penn State and the students we serve so well. Thank you.
Thank you, sir. And we're going to move right to the questions, and Dr. Barron, we'll continue with you. The numbers of COVID-positive students continue to rise, and as you said, many faculty are concerned about how this could affect them. Are the university systems working?
So we obviously have a very detailed, complex strategy, which is focused initially from pre-arrival testing to surveillance testing, to on-demand testing, to pop-up testing, to tracing, to quarantine and isolation. And each one of these is incredibly important in terms of us managing the spread of this virus. And so it is that focus that is allowing us to go forward, because along with those elements of hospitalizations that remain at very low levels, a very little change in quarantine isolation space, and not seeing transfer from students to faculty and the community. These are really the keys for us moving forward, not just those numbers.
Thank you. Dr. Barron, you mentioned it wasn't one single number that would cause us to make a change. Dr. Black, could you expand on what we are looking for? Dr. Black is our interim dean of the College of Medicine. Again, could you tell us a little bit about those factors that we're looking for?
Certainly, and thanks for the question. There is no one number in isolation, but it really is a combination of factors, looking at disease prevalence in the student body, the number of students that are symptomatic and positive, as well as those identified through surveillance testing. On a daily basis, we're following our isolation capacity and our quarantine capacity. We are looking at patterns of disease prevalence in community and in daily communication with Mount Indian Medical Center in regard to their census and what they are seeing in their emergency room. Some have suggested that we switch to virtual learning now and have students return to their communities. Our students are not infecting faculty and sharing disease with each other in the classroom setting. It's a very safe setting to be in. So virtual learning does not address that. And at the same time, we've received recommendations from the Pennsylvania Department of Health and Dr. Birx and Dr. Fauci that the wrong thing to do would be to take the students and send them back to their home communities at this point in time. So there is an extensive body of data that we look at on a regular basis that is guiding our decision making at this point in time.
Thank you, Dr. Black. Dr. Barron, I understand you have something you'd like to add.
Well, so I do think it's important to be thinking about this. Is there a number that it will take for us to pivot to remote learning? And Dr. Black was really describing this as a multi-factor component here. But what's important to realize is there isn't a magic number that's an off-on switch. There are actually a lot of different components to what we might do in order to be able to mitigate changes. We can place an entire cohort of students in a program into quarantine. We could look at a building for which we're seeing too many cases and take steps for that building. We could take a residence hall and decide that it should go into quarantine for a 2-week period because we're seeing too many cases. We could do the same thing as an individual campus for which we see growth, a team for which we see a growth. We could decide that the entire university should take a 2-week pause to be able to control any changes in the virus. Or, in fact, we could decide to take all of Penn State to remote learning. So there are multiple off-ramps and even some on-ramps. And so it's important to think here in this context that there's not just one number. We have a tendency to focus on that number of cases, not even thinking about how many are aging off of the system, when actually it's a multifaceted focus and multiple off-ramps that would allow us to mitigate the growth in the virus.
Thank you. So it sounds like you're saying not only is there not one number that would cause a reaction, but there are also not just one in solution.
Exactly.
Thank you, sir. Kelly Walgast, speaking of those concerns that faculty have expressed, what do faculty and staff need to know about the testing options that are available to them and the contact tracing programs as they pertain to those employees?
Yes, we continue to test faculty and staff with our random surveillance testing program. That is active and ongoing. We are getting ready to introduce at University Park a walk-up testing capacity for our faculty and staff who have interactions with students and have concerns that they may have been exposed to the virus. So more to follow on that coming soon. We also have ability for all our employees to get any information about this through our occupational medicine clinic. And we encourage faculty and staff who have questions to contact occupational medicine. Same with our Commonwealth campuses. The faculty and staff there have a variety of methods for employee testing, and we encourage them to reach out to their campus representatives.
Thank you. Provost Jones, are you still involving many faculty members in your decision-making processes moving forward?
Hi, Ben. Nice to see you. Yes, absolutely. Our faculty and our staff are a great resource and have been a great resource to us, and we continue to involve them in all aspects of the process moving forward. I think everybody is aware that we did involve faculty in the return to campus planning and in shaping what fall classes would look like. And I know that President Barron said this just a few moments ago, but I'll just reiterate, we're extremely thankful for everybody's extraordinary work in a complex, challenging, and fast-moving environment that the pandemic represents. Over the course of the summer, I had several meetings with the leadership of the Senate in big Zoom sessions so that I could keep the Senate fully informed about developments and what we were thinking, what some of the issues and challenges were, and solicited their feedback and got quite a bit, both in those Zoom sessions and in follow-up emails. We also have a number of research projects underway that are informing our operations. This includes the monitoring of wastewater from Penn State and the State College Barron. We have the Data for Action project, which is focused on monitoring members in the broader State College communities, and many other examples of faculty rolling up their sleeves and contributing in many ways to this effort. Thanks to faculty participation in these processes, senior leadership has been able to incorporate the input truly of hundreds of faculty and staff members across the university in our return and in current campus operations. And of course, at the core of this are our health and infectious disease experts. They were really instrumental from early on in this pandemic, back in the spring, actually, right through the summer and continuing into the fall, in helping shape and guide our response and our planning, and that planning that we're now implementing on a daily basis.
Thank you, sir. Dr. Barron, sticking with the numbers we're discussing, is what the university doing to control student behavior both on and off campus working? And for example, have any students been sanctioned as a result of impropriety?
So first of all, I would like to say how proud I am of the fact that so many students, faculty and staff are paying attention. As I travel around campus and see the masking, as I teach my own class face-to-face and see the social distancing and masking, I'm just incredibly proud that so many people are taking it seriously. Now, I must admit that when I see a community member not wearing a mask in a crowd, I cringe, or if it's a student, I cringe. And when I hear about some event or party, I worry deeply about what that impact is about. So we can be very happy that so many people are paying attention, but the notion is if mask up or pack up, if pack up means something, then if we have cases for which students are not following the rules, we have to be able to take action. We have several of those cases going through the student conduct process, and I believe are nearly completed, and we will see sanctions for students that basically just flaunted the rules and put other people in our university community or community at risk. Even though hopefully that has a strong impact, and coupled with the fact that we have an awful lot of people that are doing the right thing, we just have to stay vigilant. This is not a set of circumstances where we can let fatigue get the better of us. We have to continue to be vigilant, wear masks, and social distance if we're going to beat this back.
Thank you, sir. Dr. Black, how many employees have tested positive, and medically, how serious have their cases been?
Since the onset of surveillance testing, there has been one employee who has tested positive. There have been some additional employees who have become COVID positive and symptomatic, but they became infected related to activities outside of the work environment. It's important to recognize that while this is a tremendously serious disease that we should all be concerned about, the vast majority of people that are infected with COVID either have no symptoms or mild to moderate symptoms. In looking at the numbers at Mount Nittany Medical Center, their number of admissions have continued to remain in the low single digits, which is significantly less than the numbers that they had in the hospital in the springtime. So we are not seeing an increase in the number of admissions to Mount Nittany or a significant increase in emergency room visits related to COVID.
Thank you. Lorraine Goff, can you explain how the surveillance paperwork affects employees as they return to work?
Yes, Ben, and thank you for that question. Employees are randomly selected to participate in surveillance testing, and it's based on the return to on-campus work database. So if an employee is working remotely and they wish to be removed from surveillance testing, they should speak with their supervisor regarding being removed from that database. Now, if an employee is selected for testing, you'll be notified via email, and there'll be instructions on where and when you can go to get tested, and what you should bring with you as well. The test results will be sent via your Penn State email account, and the results are usually available within 48 to 72 hours. Now, there are several factors in determining who should be part of the testing pool, how often they're on campus, the situation while you're on campus, the number of people that are around. So it's important for employees to speak with their supervisors to determine what the best course of action is if they are not on campus on an ongoing basis, but they do return to campus from time to time.
Thank you for clarifying that. Dr. Barron, the university recently announced some changes to fall sports. And obviously this has created many questions, and many people want to know how this is going to affect them. They've called it controversial. Why did the university and the Big Ten change their minds and reverse course? So,
we set out at the beginning to have fall sports, and it was controversial when I, along with the majority of the Big Ten, voted to postpone them. And it was controversial again to move forward. The difference and our focus was on the safety of the athletes. We have a significant number of students who were rather dramatically influenced by their ability to play sports and the opportunities that presents. And as you know, one of our goals is to help get students to the finish line. But I refused to go forward if I couldn't ensure that our student athletes were going to be safe. And in particular, that meant knowing that a team that was visiting or that we were playing, that they were safe and COVID-free. And as it turned out, in early August, we could not make that guarantee. And we also had a lot of lingering issues related to downstream effects like myocarditis that, although they weren't the factor in the decision, they were a part of it because it added more risk. We then, as a Big Ten, started to look at when and under what conditions. And we watched the capability for us to move forward with new testing strategies that are starting to come online as a different opportunity. A large number of people went to work, came up with a set of protocols, including having an infectious disease guru, expert, that would be looking at the data to make sure that this was data-driven, any decision that would be made. And two, that there would be daily testing and a test result taken the same day within 4 hours of entering the field of play. So by doing this, we could ensure that those individuals that were playing would be safe and not come into contact with the infection. And the antigen tests sense that infection earlier than many of the other testing strategies. And it was the Big Ten that wrote the contract, had the capability to do this, to manage it so that it was independent of the universities and would not affect our ability to do testing as we do more and more as we're capable of doing it. And finally, we agreed that part of an even playing field was not to have anyone in the stands other than family members. So this was a health and safety decision. No other factors enter into that decision. It was whether or not we could do it safely. And as soon as I listened to the strategies that were going to be employed and then listened to one medical expert after another at the different Big Ten universities who one by one said, under these conditions, we can play. And so I changed my vote. But we're going to work hard to make sure that we continue to be safe. And if those protocols fall down, we will not play that game.
Thank you for making that clear, sir. Dr. Barron, we're going to stick with you because an accompanying concern that many people have is spread in the community as a result of people playing football. What is the university doing to prevent that virus spread as a result of tailgating or other football-related gatherings?
Well, a lot of these questions address exactly what it is that I worry about all of the time. And this is probably in all of those different strategies the thing that is that we worry about the most. So the first step, agreed to again by all the Big Ten presidents and chancellors, is that there will be no tailgating. There will be no tailgating on our property, certainly not in proximity. But of course, that doesn't mean someone might not decide to have a party in their home, to have a watch party. And my feeling is that no matter what, we will find people that will want to have those parties, maybe for some other team, because of their keen need and desire to be able to have that type of event. So it may be something that is difficult to stop, but we're going to do our best with a full court press, working with community members, working with the borough, working with the townships, working with our students. There's even a factor that's included in there of the community of people that touch sports, that if they have a high infection rate, the team won't be able to play. So there's a lot of messaging and effort that we have to do, and we're going to work hard at that. But the first step is our parking lots are closed. Our campus spaces are closed. And we're going to work on that messaging with the Alumni Society, with local folks, with our parents and families. Please don't come into our community. If you enjoy football and you enjoy those other fall sports, we need you to keep our community safe. That's the only way we can keep playing.
All along, you've been discussing aspects of personal responsibility and how if people continue to follow the rules, we'll be able to have these nice things that everyone enjoys. Thank you, Dr. Barron. We're going to stick with you for just a little bit longer, and we have received many questions from people that feel the surrounding communities around Penn State campuses are bearing the brunt of the effects that the university bringing back students has created, specifically with the impact to K-12 education and concerns about that community spread. How has the university been working with those surrounding communities?
Well, again, this is an incredibly important topic, and it's one of the reasons why, from the beginning, we made contact tracing as such an incredibly important element of what we're doing, to understand how it might be spreading, to understand whether or not there's spread from students to a faculty or to a community. And so far, the evidence there is good. You heard Dr. Black talk about it, for example, in terms of our own faculty and community member testing. But there has to be a lot more. This is the reason why we're working with so many partners, why we worked with the borough and encouraged them and thanked them for passing ordinances that would focus on behavior and have fines for people that weren't paying attention, and why the other townships around University Park were taking some of those same actions. All of our campuses are different in terms of how it is that we do this, but of course, in terms of the numbers, there's right now a bigger focus on what's happening on University Park. It's the reason why we happily and eagerly agreed to collaborate with the Department of Health to put more testing and more tracing within Center County, because after all, we have a very good handle on all the tests that we're doing. We have a good understanding of what some of the contact tracing that's occurring in the communities with respect to schools, for example, and know whether or not cases are associated with someone traveling or with someone having visitors, as opposed to a connection to our student population. But the collaboration with the Department of Health will even allow us to take that one step further, and for those testing areas for which we don't have insight into the data, that may include students that are going elsewhere to get tested, for us to be able to learn and have that contact tracing so we understand exactly what is going on. The key to this, with the incredible importance of keeping our community safe, is really to understand what's happening in the hospital, what's happening in the transference, potential transference from student to faculty or staff and the community member, and what's happening in that quarantine and isolation space that tells us and signals to us what is happening in our community, and that would allow us and to pivot and to take some of those off-ramps.
But I've heard you say recently that not all of those off-ramps would even send people out of the community. Could you explain that a little bit for us?
Well, so this is a significant issue, because many times I hear people say, what will it take for you to send them home? Well, 3/4 of the students at University Park are living in apartments with leases. And those leases were signed before in many cases, before the pandemic arose. And if you ask the question, if you're remote, will you live in your apartment, or will you go home and live with mom and dad and take classes that are remote? And the answer overwhelmingly is, I paid for this apartment, I have to pay for this apartment, I'd rather be here with my friends rather than being at home with my parents taking classes that are remote. Now, this argues, not to mention the Department of Health has said to us and the federal government has said to us, do not send students home, but this argues for the university playing a more active role in the types of activities that keep students engaged and within the safe social distancing, masking, and testing strategies of the university, rather than having the university go remote, go dark on campus, and having these students operate under their own devices. It's actually more important than ever that we focus on those students and a level of engagement that will make them successful and make sure that we can manage COVID. COVID will be here no matter what, simply because of the number of people that come in and out and the fact that we have a student population for which they view State College or the other communities which are residential in our campus system, that where they view those residences as their homes.
And so it sounded like you were saying that in keeping them here, we expand our abilities to keep them in the testing and contact tracing programs.
And engaged in different activities as part of the university, and to have the ability to be enforcing masking and social distancing. We've proven that the campus is a very safe spot.
Thank you, Sarah. We've been kind of picking on you for a few questions. We'll give you a break for a moment. Lorraine, this next question will go to you. What guidance is the university giving to supervisors and managers who have employees with young children learning remotely, like in the State College School District, in terms of the flexibility for their workload and work schedules?
Yeah, great question. We continue to recognize how stressful the situation is for all of our employees, but especially for those employees caring for school-age children. We previously mentioned that we encourage individual employees to speak with their supervisor regarding their personal circumstance, so they may be able to receive some additional support. But I will share that we also have encouraged supervisors to be flexible and creative in how and when work gets done, so that our employees can manage their time in a way that allows them to also address learning at home with school-age children.
Thank you. Provost Jones, faculty members have complained that they're hearing about COVID-positive students from the students themselves rather than through the university. Can you explain what's going on with that?
Sure, Ben. So we have a pretty structured process of notification that begins with us being notified at about the same time the student is notified of a positive test. We need to be very careful about what we share with whom when. And so we have to go through this process and in an orderly manner provide confidential notifications to faculty, instructors, or supervisors so that they're able to provide accommodation and support that is appropriate. As you pointed out, in many cases, the students themselves, as soon as they find out, the first thing they do is flip off an email to their faculty members or instructors and let them know way before we're able to get that notification out. We actually think that's a great thing, that our students have that sort of relationship with their faculty members, and in fact, we encourage it. The faculty will be formally notified by us, but the fact that the students do it faster is actually a really good thing. Incidentally, this also helps enhance our contact tracing process as well, because we know of many instances where when a student tests positive, before our formal contact tracing process can take place, the students themselves often get out and tell friends with whom they've had interactions over the preceding days about the result of their positive test. This is a good thing, and it augments our contact tracing and notification process. So we're very pleased to see that students are being active in this way, and that it all helps move the information along more efficiently. We will tell faculty instructors information, limited information, but unless the student gives permission, we won't reveal details about why a student will not be in class or if a student is in isolation or quarantine. That is not our prerogative to do that, and we respect the privacy of our students.
Thank you, Provost. We're going to stick with you, and this is a topic that has come up at most of the town halls that we've held recently, but are there any different policies or projections regarding international travel and even regional and national travel?
Yes, so we are approving travel. Travel domestically is approved at the unit level now, ultimately by the unit executive, the dean, or the chancellor in most instances. but we do need our faculty and staff who are planning trips to go through that formal approval process. For international travel, first, it's actually hard to go a lot of places, and it can be, obviously you can come back, but there are complications with that. So we're still requiring that international travel be approved by my office. So those requests ultimately make their way up to my office, and we will make approvals if the case is sufficiently compelling and the proper protocols and protections are in place. We do continue to discourage personal and professional travel at this time for obvious reasons, but especially as we enter the cold and flu season. As I mentioned previously, if you do travel domestically for work, you'll need permission from your unit leader and internationally through me. And people need to be mindful of the fact that if you are traveling, you may be subjected to quarantine expectations at both your destination and at home when you return. So these are all important considerations. But travel is happening, and we are approving it on a case-by-case basis.
And the flip side of that coin that we often get asked is, are you allowing visitors onto campus? Many of our faculty members have inquired, can they bring in guest speakers? Or is there a better way that you would encourage them to do so, perhaps through Zoom or something of the like?
Certainly. Well, we're encouraging the use of virtual engagement wherever possible, of course. But there are some instances where visitors to campus really are necessary. A couple of examples that come to mind. One is searches for new positions. Obviously, it may be difficult to recruit somebody to one of our campuses when they've never had an opportunity to set foot on the campus. And so while much of the interviewing process might be done virtually, there may be a component that includes an on-campus visit. I had a request last week for a person who was installing a piece of equipment. This required international travel by the representative of the company. Again, we needed to make sure that all the proper protocols are in place, but obviously we need that equipment, we need it here and functioning, and that person needed to come. For speakers and other activities that happen at the unit level, again, we encourage the use of virtual approaches wherever possible, but in certain instances, with the approval of the unit executive, dean, chancellor, we are permitting those types of visits to occur on a controlled basis.
Thank you, sir. Dr. Barron, this next one is a somewhat complicated question. Is the university still committed to the previously announced plan of keeping students on campus until the Thanksgiving holiday and having students remain home until the end of the semester? And why is that?
So it is a complicated issue, but let's start from the point of view that our strategies for multi-layered testing, for contact tracing, for isolation, for quarantine, were all designed by our medical experts, infectious disease specialists, and public health experts to enable us to continue in this mode until Thanksgiving. And so we strive for that goal, and we are, I think, on track to achieve that goal. But I will remind everybody again that we're looking at these different parameters of hospitalization, the quarantine isolation space, the community transfer, and we have multiple off-ramps should we decide that we need to do that in order to manage what is happening with COVID. Even after that point, it is not a simple answer, because in every year we have students that don't have places to go and that continue to stay, hundreds of students in that particular category. And of course, we have the very same situation where students have signed leases and they view State College as their home, as they pay rent and see that option as preferable than to being at home. And finally, we have the third element that in stopping in-person education at Thanksgiving, that there are a lot of guidelines now being issued by the federal government and through our conversations with the Pennsylvania Department of Health, for which there are a number of key factors to make sure that we don't stop and then essentially help spread COVID to communities all around the state of Pennsylvania and the community. And so we have to take very seriously those guidelines and strategize for the best way it is for us to do our best to minimize any of that spread after students leave State College.
Thank you. And can you tell us about any university plans for students at that time before they would leave, perhaps testing before they would leave?
Yeah, so right now there are a set of conditions and options that are being provided by the Department of Health, including quarantine strategies, testing strategies. So we're right now examining those strategies to find out what is the most workable and functional for our students and university. Obviously, if you're largely a commuter campus, this is a very different topic than if you're largely a residential campus. So the rules and what we do will change depending on what the campus is. But we're actively looking at that guidance right now, and we have to be prepared, but a lot can also happen in 60 days.
Thank you, sir. Provost Jones, we'll be coming back to you. How should faculty members prepare for the final exam periods that are coming up, and are there any efforts in place to protect the integrity of that process?
Yeah, great question, Ben. So first, I would just say that we learned a tremendous amount during the spring 2020 semester when, of course, every faculty member thought that the final exam period would be conducted as everyone in the past had been conducted. And then in the middle of the semester, it was think again, it's going to be different. So we learned a lot through that process. We announced the plans for the fall semester back on June 15th, seems like a long time ago now. And we encouraged our faculty very early on to start thinking about how they would manage through this remote period post-Thanksgiving. So my expectation, my understanding is that many of our faculty have been thinking about alternate ways to do assessments in their courses that are different from the traditional way they would have delivered examinations previously. We got a lot of ideas and resources that are available on the Keep Teaching website that faculty can consult. We've got across this institution, we also have 6,500 full-time faculty and a couple of thousand part-time faculty. That's at least 8,500 ideas about how assessments can be conducted. And so I'm sure many faculty are consulting their colleagues with their particular challenges and getting ideas. So we certainly encourage that happening as well. That said, we recognize that there are some courses where the delivery of examinations can be challenging. And we do encourage faculty members as soon as possible to discuss any concerns that they may have about the process and certainly about concerns they may have relative to integrity, academic integrity processes. You should speak with your unit head, your department head, for example, and we centrally stand ready to help too for some of the particularly challenging ones that may make us scratch our heads too.
So again, that's the Keep Teaching website where a lot of those resources can be found.
That's
Lorraine,
correct. Yep.
Thank you. Lorraine, this next question is for you. Should employees who have returned to campus also plan to work at home after November 20th?
So consistent with the governor's orders, those who can work remotely or have been working remotely should continue to do so. And the decision as to whether those who have returned to working on campus should shift to remote work on November 20th will really depend on the needs of the individual unit and the responsibilities for each employee. So employees should speak with their supervisor to determine what the needs are and expectations are for that upcoming time period.
And presumably, if you've been working at home up to this point, you should probably continue to do so. But again, check with your supervisor.
That's exactly right.
All right, Lorraine, thank you. We're going to stick with you on that topic of remote work. And many people have written into us in this part of this anonymous form saying how well their units are doing remotely and how they've really adapted well to this new situation and are curious if the university is considering making that permanent.
Yeah, we've heard those comments a great deal. And so I first want to thank you all again for your flexibility as we've transitioned into this remote work environment. We have learned a great deal as we had to rapidly shift to remote work. And while we've had this question a lot, and we've been considering various options, right now our focus really is on keeping everyone safe. But I will share with you that once we get through this current health situation, and it's under more control than it is right now, especially at a national level, we will continue to explore how to incorporate all that we have learned around flexibility into our organization. And obviously, we'll be thinking about departmental needs and the expectation of each specific role. But it is certainly something we'll explore for the future.
Thank you. Provost Jones, how has the university research been affected by the hybrid model this semester?
Thanks, Ben. Well, I think most of you are aware that the university's research expenditures annually have been inching closer and closer towards the magic $1 billion per year mark for the past several years. And last year, we got sort of excruciatingly close to that, but didn't quite make it. Once COVID hit in the spring, I think we were all thinking, okay, well, this will not be the year that happens. Well, guess what? It did. $40 million increase last fiscal year in research expenditures over the year before, even with the challenges that the fourth quarter brought to us, which just is an extraordinary accomplishment by our faculty and research staff to put us up over that threshold. So the research enterprise at Penn State remains incredibly productive and robust. I think, as most of you are aware, we have been very thoughtful and careful about how we ramped the research operation back up in the fall, over the summer and into the fall. In fact, we learned a lot from bringing our researchers back that informed us about how we would manage the return to work process and return to campus process more broadly. Researchers back in most instances, in most laboratories, we're up and running again, but of course it looks a little different. Everybody's wearing protective equipment as appropriate. Everybody is social distancing and following new procedures as recommended by the Office of the Senior Vice President for Research and Environmental Health and Safety. So far, so good. We're remaining vigilant. If necessary, we can ramp down the research enterprise again, as we did in the spring, only this time. If we need to do that, we'll do it better than we did it before, because we'll have a little bit more time. But so far, so good. And I have to say, the research enterprise is just firing on all cylinders. So we're really very proud of those efforts by many people across the institution.
Certainly, congratulations in order for everyone who contributed to that grand milestone. Thank you all. Dr. Barron, some faculty members are eager to start planning for the next semester. Has the university made any decisions about spring of 2021?
So this is an incredibly important question to so many people. And you go to the spring, and over spring break, we went remote. Amazingly, had 63 had 1,000 students in remote classrooms by 10 a.m. On Monday morning. An astounding statement about our faculty who step up. And then through the summer, we kept having deadlines, what we're going to be able to say by June 15th, what we're going to be able to say by July 15th, to be able to move forward and do it well. And what you see over and over and over again is our faculty care deeply about how well they teach those classes. So I would tell you, we absolutely owe it to the faculty to give them as much sense and have as much conversation on how to move forward as possible. We are very actively looking at scenarios, and I hope very shortly that we will have the proposals on how to move forward. As I said, this is critical for our faculty that want to make sure that they do the very best for our students. I personally appreciate that deeply, and we're going to do our best to give you as much advanced warning as we possibly can.
Thank you, sir. Dr. Black, we've had many people write in and ask, why doesn't the university test more people or more frequently, as some other schools have elected to do?
Thank you, Ben. Testing is extremely important, and the university has done a lot of testing. But it's important to recognize that testing is one part of the strategy, and the testing strategy is not just about how many people and how often. So testing does not treat the disease, and the best strategy to prevent infection is what the CDC tells us about physical distancing, hand washing, and facial protection. Taking into consideration all of the logistical challenges related to University Park and over 20 campuses across the state, the testing strategy was thoughtful, it was comprehensive, and it was multifaceted, and flexibility was incorporated into that strategy. We knew there was disease prevalence across the country and that there would be infected students coming on the campus. And our goal was to try and minimize that and then flatten the curve to manage the prevalence of disease on campus once the semester started. That was done via pre-arrival quarantine, pre-arrival testing, immediately post-arrival testing, extensive symptomatic testing, and a hybrid of surveillance testing that was both strategic and studying asymptomatic individuals in an effort to detect changes in disease prevalence. We also knew we would have to be flexible in our approach, and that has occurred with additional sites and locations and different types of tests being utilized to test and do surveillance for our population. We continue to look at the numbers of Mount Nittany. We continue to look at disease prevalence in the community, and all of that continues to be taken into consideration with our decision-making going forward.
So much like you've reiterated in the previous hour, it again is not one thing, it is really a multi-layered approach.
That is correct.
Thank you, sir. Kelly Walguest, we have another one for you. And many people have written in, people who are following the news, a very educated population here at Penn State, and they're concerned when they see us referenced on lists such as the New York Times position on places of concern. What is the university's thought on this?
Thank you. Another good question, and thank you for all the wonderful questions today, really important. We're going to continue to follow our multi-tier approach to addressing the virus and the impact of the university, but of course we're concerned, and we will remain vigilant in watching the measures that we have outlined and shared with you today, monitoring all those factors daily to understand the impact of the virus on our communities and our students and our employees. And we're working very, very closely, and we'll continue to work very closely with our Department of Health colleagues, Department of Education colleagues, our local municipality colleagues, our public-private institutions. We want to ensure that we maintain that open communication and collaboration with everyone in and around our campus communities. It's very important because it really takes a team to monitor the impact of the virus on and off campus. And so we're definitely working closely with everyone we possibly can. And when we do identify areas that need for aggressive mitigation and for us to intervene, we are taking those appropriate actions in collaboration with partners. And so we will continue to do that. And I pledge to you that the Operations Center will continue to do that in support of the university.
Thank you. We are nearing the bottom of the hour, so that is about all the time we have for questions this afternoon. We tried to answer as many of the questions that were submitted through our anonymous Google form as possible, but this is just one type of communication. We will be posting more information, more answers, and more solutions in the coming days and weeks on Penn State News and the Virus Info site at virusinfo.psu.edu. Dr. Barron, is there anything you'd like to say to the audience in closing?
Well, again, I want to thank you. I want to thank our faculty and staff for your efforts during this ongoing crisis. This pandemic has tested our Penn State community in a way that nothing else has. I'm proud of how everyone has risen to meet this unprecedented challenge. And I understand that so many of us, and myself included, worry and want to make sure that we keep everybody safe. And this is foremost in our mind. And for all of those who have pushed us to do more and to complain about different things, you're welcome to continue to do so. We're going to continue to listen and do our best. And finally, I urge you, all of you, to continue to follow the protocols that we've laid out, including mask wearing, social distancing, and practicing good hygiene. It works. We know it works. At a national level, it works. And I also want to remind individuals, get your flu shots. It's vitally important that we not only protect ourselves, but those around us. More information will be shared in the coming days on some of the topics we discussed today. We will be holding another town hall in the coming weeks that will focus on students and their families. Thank you.
And thank you, Dr. Barron, Nick Jones, Kevin Black, Lorraine Goff, and Kelly Walgast for answering all of those questions today. As I mentioned before, please keep an eye out for the follow-up story. It will include an archive video from today's session in case anybody missed any part of it. There will also be a link to a survey so you can share your feedback and tell us if there's something you'd like to see, in particular at the next town hall. Please also bookmark and continue to visit virusinfo.psu.edu for the latest updates and information. You'll find a link on this site, liveevents.psu.edu. Thank you all. Good night.